Hi dear doctors, welcome to Kids Covery. Myself Dr. Parv and we are discussing a topic which is of vital importance. Since our pediatric HOD used to tell us that if you know this topic you will pass pediatrics, otherwise you can't. So the name of the topic is torch infections. So let me bring in the torch to your screens, and in the torch infection please understand that torches infection is an abbreviation, and you can remember with the help of this mnemonic about the torch infections. T for Toxoplasma, O for other infections, R for Rubella, C for CMV, H for herpes, and S for syphilis. Now in the very first slide I have tried to in order to give you in short what is torches infection, I have tried to tabulate it. So Toxoplasma is actually a triad of three things. One is going to be intracranial calcification, hydrocephalus, and chorioretinitis. Okay, so I always teach this like this. So these are the eyes. So eyes will have chorioretinitis. Okay, eyes will have chorioretinitis. Then if I just make like this becomes H, sort of H. Okay, so H for what? H for hydrocephalus, which is going to be there. And why do you think there is hydrocephalus? Why the head is enlarged? Because the child is having intracranial calcifications. Okay, because the child is having intracranial calcification starting from eye. So this is a cute little cat which I have tried to show you, and this cat has a significance that cats are the cause of spread of Toxoplasma infections. Okay, and because there is intracranial lesions which are there, you will see ring enhancing lesions. Okay, ring enhancing intracranial lesions will be there, and of course the child is going to throw seizure as well. Coming on to others, so others like one is going to be B19. The full name is Parvovirus B19, which I always teach by using my name, and Parvovirus B19 is responsible for causing hydrops fetalis. Responsible for causing what? Hydrops fetalis. Okay, hydrops fetalis. And of course VZW means Varicella-Zoster Virus. Okay, this is the Varicella-Zoster Virus which is going to be there, and the very characteristic finding in Varicella-Zoster Virus is going to be limb hypoplasia and microcephaly. So what happens? See, Parvovirus B19 is having a big baby, a balloon baby, okay, with the appearance called as slabbed cheek appearance. If you have not attended that lecture, just go through it and see it once. Slabbed cheek appearance, but of course that happens when the child is born. But since torches are the congenital abnormalities, so what you will see in that child, there will be hydrops. Now what do you mean by hydrops? Hydrops is nothing but the fluid accumulation. So in every cavity the fluid is going to get accumulated, like in pericardial fluid, pleural fluid. So naturally the child is going to be a big balloon baby, that also water filled. Okay, so can you see small v? Small v means V is going to have a small brain, small limb, whereas the B19 is going to have a balloon baby. Coming on to the next one, rubella. Everybody knows the triad: patent ductus arteriosus, cataract, and deafness, which is going to be there. So classical triad is actually important. One is the ear feature that is going to be there, that is called as SNHL. Then the eye feature that is going to be there, that is called as cataract, and of course the heart feature. Okay, in Hindi we say that in the love make the person blind and deaf. Okay, so similarly love makes the person deaf and blind. प्यार अंधा और बहरा कर देता है. Okay, और प्यार में लोग क्या देते हैं? रोज देते हैं. So R means rubella. Okay, rose. Okay, और उसके बाद में and what more you have to remember is the muffin. Okay, next is the muffin. So there is actually the blueberry muffin rash, which is also going to be seen in rubella. After that you have got CMV infection. What is CMV? Cytomegalovirus. Okay, so what is the full form of CMV? CMV stands for Cytomegalovirus. Okay, now it is going to have calcification. Now the difference between Toxoplasma calcification and CMV calcification is that C and V are coming together, so it is going to be periventricular calcification. It is going to have which calcification? Periventricular calcification. Now can you see this word coming? Mega means enlarged. So there is hepatosplenomegaly which is going to be there. And my dear friends, most common non-syndromic, please understand, most common non-syndromic cause of deafness is going to be CMV. The most common non-syndromic cause of deafness is going to be CMV, and there is a periventricular calcifications. Can you see periventricular calcifications here? It is around the ventricles, whereas in toxoplasma it is the intracerebral. Okay, intracerebral is seen in the toxoplasma. Coming on to H for herpes. Now herpes is responsible for causing herpes encephalitis, and the most common lobe which is associated with herpes is going to be temporal lobe. That is of course going to have what? It is going to have lethargy, irritability, seizure, and of course because there is encephalitis, that means inflammation, so there will be increased fluid, and because of increased fluid there will be bulging fontanelle which is going to be there. Bulging fontanelles which is going to be there in herpes. So encephalitis, and that's to which lobe? Temporal lobe is going to be there. So her means what? Her means lady, and most of the ladies will be found nowadays where? In the temples. Okay, so herpes, temples, temporal lobe. Coming on to syphilis. So syphilis is going to have a lot of things. Of course I'm going to teach you in detail about syphilis, but just remember that you must have listened to the story of three monkeys. In Hindi we say bura mat dekho, बुरा मत सुनो and बुरा मत बोलो. Okay, बुरा मत देखो, बुरा मत सुनो, बुरा मत बोलो. Don't see wrong, don't hear wrong, and don't even speak wrong. Okay, so simple things. Okay, so eyes means it has got a deafness. Ears, it means it has got cataract. Face, it has got the tooth and the bone abnormalities, and that's why on the nose you will see a saddle shaped nose. Of course other things are also going to be there. I'll teach you one by one. So just a quick revision of whatever we have studied till now. This is a periventricular calcification, so the diagnosis is going to be CMV. Next is this one. So can you see the teeth malformations? The incisors, can you see these are the incisors. So incisors are like this. This is called as Hutchinson teeth. This is called as what? This is called as Hutchinson teeth, and they have also got mulberry molars. They have also got what? Mulberry molars. Let me just show you. So can you see, this is the beautiful picture of mulberry like molars. Okay, so mulberry molars are also going to be there in syphilis only. So this is the triad, of course sensory neural deafness, and of course the interstitial keratitis, or some people say cataract. So what is Hutchinson's triad? So one is going to be teeth, Hutchinson's teeth, then eyes, that's going to be keratitis, and that's going to be deafness, the three bandars, the three monkeys. So please remember, torch infection in general are the agents which pass transplacentally, and except the herpes simplex virus, which is more likely to be passed via the birth canal. Okay, so who is going to give the birth? Her, she. Okay, so herpes from the birth canal, rest all are going to spread transplacentally. And primary infection in the first trimester often leads to most severe neonatal outcomes. Why? Because the immune system of baby is not developed, the mother is not able to give antibodies to the baby during the first trimester. That's why if the infection is happening in the first trimester, the infection is thought to be more severe. And I think I have told you that the most common cause of non-hereditary sensory neural hearing loss is going to be Cytomegalovirus. Coming on to the next part, torches infection. So blueberry muffin rash, I have tried and explained you that blueberry muffin rash is something which is most commonly seen in the rubella, although it is seen in the parvovirus also, although it is seen in the CMV also, but rubella is actually the most common one. So can you see, these are the blueberry muffin type rashes which is there. The toxoplasma, I think I have told you, so there's no reason to explain each and everything once again. Coming on to the congenital rubella syndrome, this thing I think we missed, that there is a eye ocular manifestation where we have a salt and pepper type of retinopathy. So basically there is a pigment deposition which happens. Okay, there is a pigment deposition which happens. Okay, so can you see these pigments? So there's a pigment deposition which happens in the rubella. So you can remember again with the mnemonic of PQRST, where Q has no role, P for pigmentary, R for rubella, S for salt and pepper. Okay, so these things which you have to remember, PQRST or PQRS. Okay, then after that, of course I have told you the difference between congenital toxoplasmosis. It's going to have the diffuse cerebral calcifications. In congenital CMV, it's just a periventricular calcification. Okay, now remember, in periventricular calcification is going to be there in CMV. But one thing which I want to tell you is CMV has got this M and M for microcephaly. Okay, M for what? M for microcephaly, which is going to be there. Okay, of course CMV is going to have hearing difficulties, of course CMV is going to have jaundice also, but these two things you have to remember when it comes to brain manifestations, whereas toxoplasma is going to have hydrocephalus. Toxoplasma is going to have hydrocephalus. Yes, I have told you that CMV is the most common cause of non-hereditary sensory neural deafness, not the chorioretinitis, sorry. Okay, coming on to the torch infection, so please understand that. Coming on to the herpes infection, so what is important in herpes? Herpes, I have told you, seizures are going to be there, but whenever comes herpes, see, in entire medical life, whenever herpes will come, you have to remember 2-3 things. First of all, it is going to have rash, okay, and first of all it is going to have vesicles, okay, then it is going to have painful vesicles, and next is going to be the treatment everywhere, okay, acyclovir, okay, is the treatment for the congenital herpes. Okay, anywhere you see vesicles, painful vesicles, acyclovir. Like for example, some variant of herpes are responsible for causing the skin, eye and mouth disease. The skin, eye and mouth disease, vesicles in the eyes, the mouth, the skin. Okay, so everywhere they are responsible for causing this only. Okay, wherever, I mean, herpes has got a wide spread. Okay, so in CNS it causes seizures, in skin it causes rash, vesicles, respiratory failure, hepatic failure, what not, but not everything is important. Just remember whatever I have highlighted. Coming on to syphilis. Now see, syphilis is itself a very important topic, but the part which we are going to discuss right now for syphilis is only and only congenital syphilis. Okay, the part which we are discussing right now is just the congenital syphilis. So please remember that syphilis is going to have a copious amount of nasal discharge. So they will have snuffles. Okay, first of all, let's understand this. S for syphilis, S for snuffles. Okay, S for syphilis, S for snuffles. Okay, so syphilis is going to be there having snuffle. What is snuffle? It is a persistent copious mucoid discharge. So basically snuffle is nothing but a nasal discharge which is going to be there, which is seen in congenital syphilis. Then syphilis comes with the palm and sole rash with the desquamation. Okay, so S for syphilis and S for squamation. Okay, desquamation is going to be there, where it is going to be there on the palms and sole. Okay, and palms and sole it is going to show rash with the desquamation, and of course it is going to have a symmetric long bone problems as well. Symmetric long bone problems as well. Okay, I'll show you a picture in which you will have the Sabre tibia also, that's also coming and starting from S. Then I have told you the story of monkeys also in case of syphilis. Okay, the Hutchinson's triad which we call it as. Okay, now please understand that Hutchinson, coming on to the CNS manifestations. Now CNS manifestations will be sensory neural hearing loss, this I have told you. Okay, let's understand what extra will it have. So from S it is going to have the saddle shaped nose. Now why it is going to have saddle shaped nose, I have told you, because there is a bone deformity which is going to happen, and since the bone deformity is something which we are discussing, seeing, so that's why frontal bossing is another feature, which is because of the bone, improper bone formation. Okay, of course you will be having regedes also. What is regedes? These are the perioral fissures, perioral scars which are going to be there, and of course there will be Hutchinson's teeth and mulberry molars, we have discussed already. Okay, mulberry molars which is going to be there, and this problem in the oropharynx also, and then you have got the teeth which are again Hutchinson's and everything. So just remember regedes, that means the fissures which are going to be there, the scars which are going to be there. Okay, so scars you can remember from the S itself, right? And the other thing which we have to understand is the mulberry molars, and of course the Hutchinson is something which we know very well. After that you have got key clinical manifestations of late congenital syphilis. So what is late congenital syphilis? Of course it is going to show you the hard palate perforation. Can you see? This is the hard palate which has been perforated. Okay, so hard palate perforation is this. Now you know this Hutchinson and everything, let me just tell you, Hutchinson's triad and everything, this is not seen in less than 2. So can you see this? Hutchinson is not seen here. Okay, so if it is less than 2 years, then you will not see Hutchinson's. That's why I've written it here that Hutchinson's is actually seen after the 2 years and not before the 2 years. Okay, Hutchinson is not going to be seen here. Hutchinson is not going to be seen here. And of course, there will be anterior bowing of the shins. Can you see that the shins are bowed anteriorly, anterior bowing of the shin? Then there will be recurrent bilateral knee effusions. Can you see a lot of effusion here? Can you see a lot of effusion here? So this is the recurrent bilateral knee effusions. And yes, one is something which is called as Higumenaki sign. Okay, this is the Higumenaki sign. Higumenaki sign means you will have what? You will have the enlargement of the sternal end of the clavicle. Okay, what is Higumenaki? Enlargement of what? Enlargement of the sternal end of the clavicle. Enlargement of the sternal end of the clavicle, which is going to be there. So the mnemonic turns out to be RASH. Now what is RASH? H for hard palate, which is going to show perforation. S for sebrations, and of course the Clutton's, the recurrent knee effusions. Okay, Clutton joints, or you can say the Sabre knee, which is going to be there here. And then you have got R for recurrent. Okay, recurrent Clutton's joint are going to be there. Recurrent Clutton's joint are going to be there. And A for H is actually Higumenaki sign. R, then anterior bowing of the shins. Okay, from A it is anterior bowing of the shins. Okay, then hard palate is going to have perforations. Yes, I knew. Higumenaki sign. Yes, Higumenaki sign is starting from H. So I think, yeah, this is the mnemonic which you can remember, rash. Coming on to how will you diagnose this? How will you permanently diagnose it? So toxoplasma during pregnancy is diagnosed with a combination of maternal serology plus IgG avidity test, or you can perform amniocentesis with PCR if the child is more than 18 weeks in order to check if there is some, you take the amniotic fluid and perform the PCR technique on it. For rubella, you check the IgM antibodies against the rubella. IgM antibodies against the rubella. For CMV, we do the PCR testing, but please remember, generally we take the urine sample for CMV. Herpes, of course, we do the PCR analysis on the vesicles. Then comes syphilis. So yeah, this is now important that for syphilis you are supposed to perform RPR. What is RPR? This is called as rapid plasma reagent test, or you can do VDRL also, Venereal Disease Research Laboratory testing, but RPR is important, rapid plasma reagent testing. Now pregnant women, if she is diagnosed with congenital toxoplasmosis, pregnant female, if she is diagnosed with congenital toxoplasmosis, she is going to get treated with the drug spiramycin if she is less than 18 weeks, but pyrimethamine plus sulfadiazine and leucovorin if she is more than 18 weeks. Okay, so spiramycin is less than 18 weeks. Spiramycin is going to be there in less than 18 weeks, and if it is more than 18, then pyrimethamine and sulfadiazine. See, we used to use a mnemonic called as SP. So we used to say that S and P lived together when they were less than 18 years old. Okay, just like two best friends live together, and after a certain age, like after 18 years, one has to go abroad and everything. So S and P are not living together after 18. So just to remember that S is sulfadiazine, P for pyrimethamine in more than 18, whereas S and P coming together less than 18 weeks. Rubella, no specific treatment, but yeah, vaccination is given. For CMV, for viral infections, CMV is going to have ganciclovir. How to remember? C and G look very similar, so this is how you can remember. Herpes, I have told you, whenever it is going to come, you will start acyclovir. Of course, for syphilis, this P is very important, and this P means penicillin. Okay, this P means what? This P means penicillin. So this I know is a little big video, but then it's important, so you must know every bit of torches infection. Thank you.